Welcome to Section 6 of Genetics. In this section, we'll be discussing autosomal dominant disorders. Here's a list of the autosomal dominant disorders you need to be familiar with for Step 1. Obviously, there are a lot of disorders and they cover multiple organ systems. For example, neurofibromatosis and von Hippel-Lindau disease are generally discussed in neurology, while hereditary spherocytosis is covered in hematology and Li-Fraumeni syndrome is covered in oncology. For this reason, I'm not going to focus on the details of each genetic disease in this video. They'll be covered in more detail in their respective organ systems. In this video, we'll focus on a few high-yield points. This is a table of some of the high-yield points we'll be discussing regarding autosomal dominant conditions. This can be found in Section 6 of Genetics. The first disease is achondroplasia. This is caused by a mutation in the fibroblast growth factor receptor 3. This results in impaired chondrocyte proliferation and is the most common cause of dwarfism. This condition is rare, but when it does occur, it's most often sporadic and due to advanced paternal age. Notice that this is responsible for approximately 85% of cases. The remaining 15% of cases are due to autosomal dominant inheritance. Acute intermittent porphyria is caused by mutation affecting porphobilinogen deaminase. This is an enzyme associated with heme synthesis, so a defect can result in defective heme synthesis, leading to an accumulation of toxic heme precursors. Findings include abdominal pain, neuropathy, and psychological disturbances, as well as elevated porphobilinogen in the urine. Neurofibromatosis type 1 is caused by NF1 gene mutations on chromosome 17. Symptoms include neurofibromas, café-au-lait spots, pheochromocytomas, optic gliomas, and pigmented iris hamartomas. We discuss this in more detail in Section 1 of this chapter, but this is a classic disorder that exhibits variable expression with 100% penetrance. This is an image of neurofibromas. Notice that this patient's back is completely covered in these lesions. This is a classic image of neurofibromatosis type 1. This is an image of a café-au-lait spot. In French, this means coffee with milk. You can see that this lesion looks kind of like a coffee stain, but is also relatively light brown, hence the name coffee with milk. Von Hippel-Lindau disease is caused by mutations of the VHL gene on chromosome 3. Findings include renal cell carcinoma, pheochromocytomas, and hemangioblastomas. Okay, let's do some questions. A 24-year-old male indicated by 3-2 presents to the physician with his wife for genetic counseling prior to conception. He has a disorder characterized by impaired chondrocyte proliferation resulting in dwarfism. What was the most likely cause of his disorder? Okay, impaired chondrocyte proliferation resulting in dwarfism is describing achondroplasia. Recall from our table that this is most commonly caused by sporadic mutations due to advanced paternal age. From the pedigree, we can see that this man's parents did not have the disease. In other words, the father did not have the disease, so the patient must have inherited the condition as a result of a sporadic mutation that occurred in the gametes of his father due to advanced paternal age. If the pedigree had shown that the father was affected, then we could have concluded that the cause was due to autosomal dominant inheritance, but this was not the case. So again, the most likely cause of his disorder is advanced paternal age. Okay, let's do another question. A 27-year-old female presents to the emergency department with a 3-hour history of abdominal pain and altered mental status. Several family members have presented in the past with similar problems. She states that she was at a party and consumed several alcoholic drinks when the pain began. Urine laboratory analysis reveals elevated porphobilinogen. What is most likely true of her condition? A, the pain typically starts at the periumbilical region and moves to McBurney's point. B, a diagnosis can be made based upon an elevated serum lipase. C, it results in defective heme synthesis. Or D, the pain is typically worse after eating a fatty meal. From the question stem, hopefully you notice that several of her family members have presented in the past with similar problems. This hints at the fact that the condition is genetic because it has affected multiple family members. Also, the urine analysis revealed elevated porphobilinogen, which should clue you in to a defect in heme synthesis. So this patient has acute intermittent porphyria, and the answer is C. It results in defective heme synthesis. A is alluding to acute appendicitis, B is suggestive of acute pancreatitis, and D is suggestive of cholecystitis. In summary, it's high yield to know that acute intermittent porphyria is an autosomal dominant condition that results in defective heme synthesis. Okay, let's do one more question. A 45-year-old male presents to the physician due to a 3-month history of heart palpitations, sporadic episodes of sweating, and intermittent headaches. Plasma metanephrines are elevated. Imaging of the abdomen reveals a renal mass. A biopsy is obtained, followed by cytogenetic analysis, which reveals a VHL gene mutation. What other malignancies are most likely associated with this patient's condition? Hopefully from the question stem, you notice that this patient has a pheochromocytoma. This is a tumor of the adrenal medulla and can result in heart palpitations, perspiration, headaches, hypertension, and pallor. All of these symptoms are caused by elevated catecholamines, which simulate a fight-or-flight response, so hopefully the symptoms should be pretty intuitive to you. Because the question states that he has a VHL gene mutation, we can conclude that this patient has von Hippel-Lindau disease. As we just discussed, von Hippel-Lindau disease is also associated with renal cell carcinoma and hemangioblastomas.